It's a busy day in clinic, as usual. I'm running late. It'd be really easy to appear rushed. But patients judge us on feeling listened to and feeling that we've taken enough time with them. If I appear rushed by moving too fast or speaking too quickly, my patient may not trust what I have to say.
Come in.
Hello.
Hi.
Are you Jacqueline Thompson?
I am.
Hi, I'm Dr. Coleman.
Hi.
Cliff Coleman here. Hi. Nice to meet you.
Nice to meet you.
Thanks for waiting.
No
I'm sorry I'm late. I
problem.
apologize.
That's okay. That's okay.
Okay. Even though I'm running late, I want Jackie to feel like she has my full attention. So I'm going to spend at least 30 seconds with her, maybe longer, face to face, before I turn to the computer. All right, I'm just going to move this out of our way for a second. Do you like to go by Miss Thompson or Jacqueline?
Jackie is fine.
Jackie.
Yeah,
Right. Okay.
Jackie.
Thanks. At this point, I've done most of the initial relationship building tasks, which set the tone for the visit. The whole thing has taken less than a minute. Okay. Well, Jackie, I was looking at your chart notes. I saw that you've been in a couple weeks ago. You're new to the clinic.
Right.
You were in for some thumb pain, and they noticed that your blood pressure was high last time.
That's right.
So I think you're back today to check on the blood pressure. Is that right?
Yeah, it was high, and I'd had this pain in my thumb, and I was taking ibuprofen for it. The doctor felt that maybe the ibuprofen was causing the high blood pressure.
Right.
So he asked me to go off of it, and I did. But my blood pressure is still high, and I'm pretty worried about that.
Yeah. So it's been worrying you.
Yeah,
Okay.
definitely.
Yeah, I'm sorry. All right. Well, we'll take care of that today.
Okay.
Before we get into the details of that, I just want to find out if there's anything else on your mind that you're concerned about or that you'd like to try to take care of today.
Well, I've had a mole on my arm that has been there for a while, and it's never been checked, so maybe that should get looked at.
Yeah, okay, we can do that.
Okay.
Yeah, so blood pressure, mole. Anything else that's concerning you?
Well, as long as you're asking, I do have knee pain that's been there again, maybe 2-3 years, and I've never had that checked. So it's been more painful lately. I wouldn't mind you looking at that too.
Okay. All right, so we have blood pressure, mole, right knee pains, I guess.
Yeah, it's quite painful.
Okay, all right.
Yeah.
You mind if I take some notes here?
No.
We're going to make a list here.
Yeah.
Okay, I'm going to kind of turn this so you can sort of see what I'm doing. Okay, so those 3 things. Anything else that's concerning you today that you'd like me to take care of?
I think that's it. Yeah.
All right. Blood pressure, a mole on the left arm.
Left arm.
Okay. The right knee pain.
Right.
Probably thumb pain. Okay. All right. We might not be able to do a good job with all of Jackie's concerns during this 15-minute appointment, but just getting the full list of concerns is only the beginning. Now we need to negotiate which issues we're going to address. Well, so of these things, I want to make sure that we take care of your most important issues first.
Okay.
What do you want to make sure we take care of today? What's most important?
Well, I'm most worried about my blood pressure.
Sure.
Yeah, I think that's the thing that's worrying me the most. And then, of course, since I'm still having a lot of pain in the thumb,
Okay.
that would be close to second.
Okay.
Yeah.
All right. Okay. I think we should focus on those 2 things.
Okay.
The thumb and the blood pressure.
Okay.
I'll be happy to take a look at that mole if there's time.
Okay.
I think the knee pain might take longer. And,
Right.
If it's okay with you, what I'd like to do is set you up for another visit to specifically deal with knee.
Okay.
As I don't think we'll have time to do a good job with that today.
That's
Would that be okay?
Yeah.
Okay. All right. Now I know the list of concerns that Jackie might want to talk about today. If I had just jumped in on the blood pressure issue and started with that, we might have run out of time at the end to talk about anything else. Now, it took about 2 minutes to do the agenda setting with her, and that might seem like a long time in just a 15-minute office visit. But I probably saved a few minutes at the end by avoiding any so-called doorknob questions which would have otherwise come up. All right, well, I'm going to ask you some more questions then about blood pressure, the thumb, and the mole, and then
Okay.
we'll do a physical examination. We'll see what we need to do to take
Great.
care of those things.
Okay.
Well, Jackie, everything looks fine,
Okay.
so that's good.
That is good.
So your blood pressure is still high, so we need to come up with a plan for that.
Yeah.
So now it's time to make a plan, and that means giving information. The message needs to be simple, understandable, and easy to act on. Why don't we go through each of the 3 things that we talked about
Okay.
and make a plan for each one of them,
Okay.
and then at the end of that, I'm going to ask you to tell the plan back to me so I can be sure that I did a good job explaining things clearly.
All right.
Okay.
All right.
And we'll start with the simplest thing first. So let's talk about the mole. So the mole is a common mole. We don't need to do anything about it. We're just going to watch it, right?
Right.
Okay.
Okay.
For the thumb, for the arthritis there, it looks like a common form of arthritis just from unusual wear and tear. There's nothing in your history or in your exam that suggests anything else. I don't think we really need to do any other testing for that.
Okay.
And I think if you can use the acetaminophen that you've been using, and if that works fine, then good, go ahead and do that. If it's not working well enough for you, there are other things that we can use, like a topical cream. We might even talk about sending you to a hand therapist for some exercises.
All right.
So just let me know if you feel like it's stopping you from doing things and we want to try something else.
Okay.
What you can't use is the ibuprofen or medicines like that anymore.
Right.
So if you do want to take something else, check with a pharmacist or with us before you start using anything else for the pain.
Okay.
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 For your blood pressure, you have high blood pressure.
Mm-hmm.
I'm sorry to say.
Mm-hmm.
Some people call it hypertension. That's the same thing. High
Right.
blood pressure, hypertension. How much have you already learned about high blood pressure, hypertension?
Well, it's bad for your heart. I know, both my parents have it. There are 2 numbers, both of mine are high. That's about basically it.
Yeah, that's a good amount. Well, I'll tell you a little bit more about it.
Okay.
Before I do that, what's your best way to learn about health information? Do you like to read things? Do you like to go online? Do you prefer to hear it from me?
I can hear it from you. It's great. If there's something you want me to read, I'm happy to take that with me or whatever. And if it's going to be helpful, I can do that too.
Sure. Yeah, I've got a handout that I can go over with you before you go.
Okay. Okay.
Okay, that sounds good. So high blood pressure or hypertension. In your case, your blood pressure today was 164 over 96.
Mm-hmm.
It's actually a little bit better than it was last time you were in.
Mm-hmm.
It's still too high. Ideally, it would probably be better for yours to be around 130 over 80
Okay.
or so. So it needs to come down.
Right.
And the reason why we care about that is blood pressure is a measurement of how much force it takes for the heart to push blood through the arteries, those tubes that carry blood from the heart out to the rest of the body.
Right.
And when the pressure is high, when the heart needs to push harder to get that blood to go through those tubes, it can end up causing damage to some of the internal organs in the body over time, like things like the heart and the brain,
Right.
the eyes, the kidneys. So we don't want to leave it running high.
Mm-hmm.
We want to do some things to help bring it back down to normal to help protect all those other organs. For some people, though, there's some underlying problem that's causing the blood pressure to be high. Kidney problems, for example, could sometimes do that.
Mm-hmm.
So we ought to do some testing for you today to look for any causes for why your blood pressure would be high, and then also to look to make sure that it hasn't already started to cause any damage to any of your organs.
Okay.
So to do that, I'd like to do a urine test to check your kidneys. I'd like to do a blood test also to check your kidneys in a different way. Would you feel up to getting a blood test today?
Sure. Yeah.
Okay. All right, we'll do that. I'm going to also, in your blood test, I'm going to add on a test to check for diabetes, which is when there's too much sugar in the blood.
Right.
We'll do that at the same time. I also want to do an EKG of the heart to test the heart. Are you familiar with that test?
Oh, yeah, where they attach wires and then you're looking at the thing going up and down.
Right, yeah.
Yeah. So, do you think that I have diabetes? Is that what you're worried about, though, too?
I don't think you have diabetes. There's no sign that you have diabetes right now, but anybody who's got high blood pressure, we ought to just check for that.
Okay.
So that's just a good part of the routine evaluation.
Right.
All right, so let's do that. After we see your test results, then I'll be able to give you good advice about how to lower your blood pressure.
All right.
Okay, which is going to involve probably talking about foods,
Mm-hmm.
talking about exercise, and then most likely we're going to recommend using medication to lower your blood pressure as well.
Okay.
All right. So now that we've got a plan made, I need to make sure that Jackie has a clear understanding of the main take-home messages. Jackie's obviously paying close attention, and she really seems to be understanding the plan. But I know from the research that you can't tell which patients understand you just by looking at them or listening to them. I'm going to use the last 1 or 2 minutes here to confirm that I've been clear in describing the plan. So let me just re-summarize the plan,
Mm-hmm.
and then I'll have you tell it back to me.
Okay.
So for the mole, we're just going to watch it. For the thumb arthritis, no more ibuprofen or medications like it. Acetaminophen is fine. And then if you decide you need more and you want to take something else, check with us or check with your pharmacist before you take anything else.
Okay.
And if things aren't working well, let me know. There's some other things that we can try from here.
Okay.
For your blood pressure, we're going to do some tests today. A urine sample, blood test, an EKG.
Mm-hmm.
And then I'm going to see you back here in about a week or two. We'll go over all of that, and we'll make a good plan for how to get your blood pressure down.
Okay.
I know from studies that patients frequently fail to ask questions, even when they clearly don't understand something. So, what questions do you have for me about this?
Well, do you think I should start taking the blood pressure medication now?
That's a good question.
Yeah.
I don't think you need anything today. So as far as I can see, having high blood pressure is not causing you any damage that we can identify right now.
Mm-hmm.
The tests we'll do today will help us figure that out a little bit. As long as theirs are normal, I think it's safe to wait a week or two without causing any additional harm.
Okay.
Okay.
Good.
Yeah.
All right.
I'll call you if there's anything out of the ordinary on the blood test.
Okay.
Okay. Good question. What other questions do you have?
I don't have any other questions, I don't think. I think that's it.
Okay.
Yeah.
Okay. I've summarized the plan, and I've elicited Jackie's questions using an open-ended format, but I still don't know if I've explained things clearly or if she's understood them adequately. Now, to make sure I've done my job well and explained things clearly, if you will tell me back the plan, I'm going to type it on your
Okay.
visit summary here, and then I'll send that home with you.
Okay.
All right.
Okay.
Okay. So, for your blood pressure, what are we gonna do?
You're gonna do some tests to check out my heart.
That's right. Yep. So test today. Okay. All right. And then what?
You're gonna call me with the test results.
Yeah, that's right. Call you. Okay. Yeah. And then what?
And then, you want me to come back in a week, I think?
Yeah, a week or two.
A week or two, okay. And, so do I need to make an appointment for that?
Yes. So you need to make that appointment before you leave today.
Okay,
Okay. And 1 to 2 weeks is fine.
okay.
Okay.
Mm-hmm.
All right. So I'm gonna send my assistant back in.
Okay,
We'll get the urine sample, get the EKG done, then we'll send you down the hall for the blood test. On your way out, please make sure you stop at the desk and get the appointment in about a week or two.
okay.